Hi, my name is Mandy Renfrew-Cuncio, and I am doing this video today on a little bit of an introduction to pelvic girdle pain. Specifically, I'm going to talk about pelvic girdle pain during pregnancy. And in future videos of this series, I hope to give you a few tips and tricks to hopefully help you feel better if you are indeed experiencing this. So to start at the beginning, let's talk about what is pelvic girdle pain. So to do that, we're going to orient ourselves to a little bit of anatomy. So here you can see my model of the bony pelvis. In the back, you can see some of the big lumbar spine or lower back vertebra. So our spine kind of comes down. And where our spine finishes is in this triangle bone at the base of the spine called the sacrum. And if we keep going down to the bottom, our sacrum finishes in another little triangle bone called the coccyx or the tailbone. The pelvis, though, if you take this kind of inside top-down view, you can see that it is a bony circle or ring structure. That's where the term girdle comes from, just that idea of a circle. So on either side, you can see there are these big wing bones, also known as the ilium. So if you were to, in your own body, put your hands on your hips, you're not actually putting your hands on your hips at all. You're putting them on the big wing bones or on the ilium. So again, the wing bones wrap around in the back and they join with that sacrum, and on either side they form joints called the sacroiliac joints, or your SI joints, as many people know them as. In the front, the big wing bones wrap around to form into your pubic bones, and they join in the center with their own cartilaginous joint that's called the pubic symphysis. On either side, your wing ilium bones transition down into the ischiums, or your sit bones, at the very bottom, but they leave room to kind of make your hip sockets on either side too. So pelvic girdle pain during pregnancy or any time, but pelvic girdle pain just means pain somewhere in the area of the pelvic girdle. Lots of people during pregnancy could feel pain low down in the pubic bone in the front, quite centrally towards the middle. And this is often called pubic symphysis dysfunction because it's pain near that joint. Typically, this pain can feel sharp, so other people might call it things like lightning crotch. But it's still pelvic girdle pain because it's in the area of the pelvic girdle. Other pregnant people could feel pain in different places. So some people will feel pain on either side in their hips, in this area here. Other people will feel pain in the back. So some people will get lower back pain or pain a little bit on either side in those sacroiliac joints. Sometimes people will get pain a little bit lower in the buttocks, right? Other people might feel pain all the way low by the sit bones, okay, or in the pelvic floor, kind of that bottom of the bottom sensation. And all those descriptions of pain we can put under the heading or the title of pelvic girdle pain. Now, pelvic girdle pain can be just a little bothersome. Like, it can be kind of annoying, you feel it, but you get on with your day. But for others, pelvic girdle pain can be really quite severe, really uncomfortable, and really limiting in terms of what people are able to do in their day-to-day life. So, because there's so much variability, sometimes it's hard to talk about. But one common question I get a lot is, why? Why do we get pelvic girdle pain during pregnancy? You know, it is common. It's super common. So some research suggests that 30 to 50% of pregnant people will experience pelvic girdle pain, you know, by 20 weeks of pregnancy. Further to that, 60 to 70% of pregnant folks could feel pain in the last trimester, in the third trimester. So lots of people are definitely experiencing it. There's no easy answer, though, to why, okay? The human pain experience is actually a super complex phenomenon. And, you know, we do know there are lots of changes and adaptations going on in our pelvis during pregnancy. Okay, there's a hormonal influence on the support structures for the pelvis. This allows the pelvis to start moving a little bit more, becoming just a little bit more mobile in preparation for birth and to handle, you know, the increased loads and demands that it's under, because it's absolutely under increased physical load and demand. The muscles that normally would support your pelvis during pregnancy, your abdominal wall, your pelvic floor on the bottom, they are also adapting and changing. So your abdominal wall is lengthening, right, to allow the growth of hopefully a full-term baby. Your pelvic floor is also challenged, you know, it's under stress as it doesn't just carry you around anymore, it carries your increased blood volume and the amniotic fluid and the placenta and a baby that's growing and literally getting bigger day by day. So there are absolutely biomechanical changes and adaptations that may be going on in the pelvis that could possibly be contributing to someone's experience of pain. But pain is even more complex than that. So as if there wasn't enough going on already with just that, there are many other factors that influence our pain. So yes, hormones and chemistry, our body chemistry can play a role in how we experience pain. In fact, pain is, you know, primarily mediated by the brain, by the central nervous system, which means the central nervous system is actually the biggest player here. That means things like sleep, which is often disrupted in pregnancy, or stress, which, hello, COVID and other areas, you know, lots of stress in people's lives, and our emotions. All of these factors can play a really large role in someone's experience of pain. And when we're looking at pelvic girdle pain, it's really important to consider that we are complex human beings and there's never just one thing, right? There's usually multifactorial reasons or different inputs and systems that are influencing how we feel in our body, and that includes pelvic girdle pain. Okay. So we've talked about the very many factors that could be influencing pain, and the influences are different for everyone. But there are also a few risk factors that the research does show us could make it a little bit more likely for you to experience pelvic girdle pain during your pregnancy. So the first one is if you've already experienced low back or pelvic girdle pain prior to getting pregnant, then you could be more likely to experience pelvic girdle pain during pregnancy as well. A second risk factor is previous injury to your lower back or pelvis. So particularly if you have a memorable fall on your butt or a tailbone injury that you remember, or perhaps you have a history of being a horseback rider or a figure skater. But if you've had previous injury, even from a fall or a work accident, to your lower back or pelvis, you could be more likely to experience pelvic girdle pain during pregnancy as well. A third risk factor is if you have a demanding job with lots of heavy lifting or even a lot of prolonged sitting, that could make you more likely to experience pelvic girdle pain during pregnancy. If you have a higher BMI, body mass index, and unfortunately, if you've had pelvic girdle pain in a previous pregnancy, you are more likely to experience it again during a subsequent pregnancy. And lots of people would say they feel it earlier during that subsequent pregnancy as well. So again, I know this sounds like a lot of doom and gloom, but it's an important subject to talk about because so many people do experience pain during pregnancy, pelvic girdle pain in particular. That being said, again, I want you to be encouraged because the biggest take-home message is pain is changeable, okay? There are very many systems influencing our pain, but that means we have lots of different places that we can change inputs and hopefully have an influence and positively improve your symptoms and change the experience you're having with the pain in your body. The other little thing we can cling to is that the vast majority of people who experience pelvic girdle pain during pregnancy see it resolve very quickly after baby's born. So hopefully we can take a little comfort in knowing that it's a temporary challenge for most people. That being said, you don't have to suffer, okay? You don't just have to put up with it. Again, lots of places we can have an influence, mediate, and change the pain you're experiencing. So stay tuned for future videos where we talk about tips and tricks on how to help you change that pain and hopefully be more comfortable and feel more confident in your ability to do things and have a great experience of pregnancy and in your body. Thanks for tuning in.